So generally, if it wasn't there in the morning and it's suddenly quite large, you should probably bring it in because it's probably something that's quite painful. Dog's not necessarily crying because they don't show pain like that, but that's a whole nother discussion. 24 hours, suddenly you've got a small little hot spot and they spread really quickly, especially in those long-haired dogs where you can't actually, you think it's that size, but as soon as you take the hair off, you realize how extensive it's spread underneath. Even in a day or two, it's actually amazing how quickly those can go wrong.
So from tiny lump to big,
to a massive thing. And it's painful and itchy. You really want to get on top of that quite fast.
Welcome back to the Paws Effect Podcast. I am your host, Dr. Cara, and today we're getting into a topic that every pet owner dreads: discovering a lump on their dog or cat. It's one of the most common reasons pets are brought into the vet, and understandably, it can be a source of serious anxiety. Joining me today is my colleague and fellow veterinarian at Hillcrest Veterinary Hospital, Dr. Lauren Myles. Lauren is calm under pressure, sharp in diagnostics, and has a real gift for helping pet owners navigate these worrying situations with clarity and compassion. Before we get into it, a quick thank you to Stitch for the vibrant green scrubs that I'm wearing today. I usually default to black, but have to admit, these look fresh, feel amazing, and hold up beautifully during a chaotic shift. And just a reminder, if this podcast has been helpful to you, please hit that subscribe button, leave a review, or share the episode with someone you know. Your support helps keep these conversations going, and I'm so grateful that you're here. So, what's that lump? Well, today we're going to talk about the difference between the urgent and the harmless, the benign and the malignant, and the inflamed and just plain odd. We'll also share a few funny stories from the clinic floor, because let's face it, not every lump is a disaster. Let's get into it. So a very warm welcome, Lauren, to the Paws Effect Podcast. I'm here with my colleague from Hillcrest Vets, and we're going to discuss lumps. What's that lump? So I thought I'd open the conversation because, you and I, we could talk about this all day, but when we first discussed doing this topic, we got into the humor of some of the things that we have seen historically. So as an opening question, you know where I'm going with this.
Yeah.
What is the funniest case that you've seen, just on a lighter note before we get into the technical stuff?
It was probably funny the first time, but it becomes common, like a couple of times a year, people come in and they're like, what are those? My dog's got these lumps and I'm really worried about them. They're next to the penis and sometimes they're there and sometimes they're not. And then I have to explain a little bit about the bulbous penis and how it gets engorged when doggies get excited. And, that lump that's there when you come home and he's really happy to see you. It's nothing to worry about, actually.
Very, very normal. Very benign.
Yeah, you sit there having a conversation with the client like, try to be professional. but yeah.
I was sharing mine, which was the one where look, it's generally and I love my listeners. So again, I've got to always do that sort of disclaimer thing where it's like we're not judging. We totally understand. We actually love some of the lighter stuff. It's great when there's something not serious. So please don't be put off by bringing anything to us. We'd rather say, no, it's normal. But my case was when a gentleman brought his dog in for these lumps that he'd been trying to remove. And they were nipples. And he was like, but it's a boy. I don't understand why. I don't understand this. It's like, no, those are nipples. Please stop trying to remove nipples from your dog.
That's also quite a fun game. Like, is this a tick or is it a nipple?
Yeah.
And then you got to get in there and see, does it have legs or not?
Yeah, exactly. So that lump that doesn't need to be removed is often the comic one.
Yeah. No, I must say often when, maybe I shouldn't be telling you this, but
yeah, please, as the practice owner, please don't tell me you're turning away consults.
I don't turn them away, but if they come in for the nipple, I don't charge them a consult for that.
I think that would be awful. I don't think we'd see them return. So
yeah, you don't want them to be put off for, if they're worried, they must come in, even if it is just a nipple.
No.
And then if it is, they probably should be nice about it.
But this is obviously going on to more serious stuff. This is a common consult, whether it be generally sort of during the day or even at night. We see what is that lump. We have the lump thing on the appointment list. really often, multiple ones a day. And this is something that is really frightening for owners. Often they worry like, oh, it's just come up, or I've been watching this and it's changing. So, I want to go through this quite methodically in terms of trying to categorize these things so that we can just provide some clarity on it, maybe give some reassurance to owners on when they should come in, when they should really prioritize it, what is like a risky lump versus a very benign one that they can relax about and book the appointment the next day rather than waking you up at 3 a.m. or 4 a.m. when they get up. So yeah, let's talk about some of the terms. I think probably let's start off with the acute versus sort of the chronic lump. What is acute? Because often people say it's come up, suddenly, and we're talking acute and chronic things. And I think some of the terminology that we use can sometimes confuse our owners.
Yeah, so an acute lump has only been there for maybe a couple of hours, maybe a day or two, whereas a chronic lump has been something that's been growing over, weeks, sometimes months even. You've been watching this small little thing and, last year it was that big and now it's that big. And, the way they're changing over time has got a lot to do with, it's quite a good way to tell as a little bit of it's an insensitive test. But, if something is small and it's growing quite slowly, that doesn't necessarily mean it's benign. But something that's doubled in size over 3 weeks is going to double in size over the next 3 weeks again, whereas something that's doubled in size over 3 years is probably not going to get another double in size for, a year or two. So it's quite a good, how fast it's changing is a good indication of how quickly you should be bringing it in.
Absolutely.
But generally, any lump, you should rather check it out sooner than later.
So before we get into some of the technical stuff, the benign versus the malignant, and we'll clarify what that means in a bit, so be patient. Can we talk about some of the lumps that particularly you see or we see as emergencies, those ones that come up that are acute and sometimes are sort of inflammatory in origin or are due to some kind of bite, and what I'm referring to there are obviously some of the snake bites and whatnot.
The insects.
Yeah, can we have a discussion about how proactive owners need to be when they see a swelling? Maybe they've been at work and they come home and they see the swelling, whether it's multiple little lumps or whether it's a single lump that could be inflammatory in origin.
Yeah, well, here where we are in KZN, it's probably a good idea if you see a swelling to come in very fast because we have a lot of dangerous snakes. But a lot of times also it's bee stings or, there might be an abscess or something like that. So generally, if it wasn't there in the morning and it's suddenly quite large, you should probably bring it in because it's probably something that's quite painful because, if a swelling gets that big that quickly, occasionally they won't be. But a lot of times they will be quite painful. The dog's not necessarily crying because they don't show pain like that, but that's a whole nother discussion. But yeah, those are generally emergency patients that we should see because, if it's a snake bite, we'd want to give quite intensive support for that, especially the snakes in our area. If it's an abscess, we'd want to drain that to get rid of that infection. The ones in the ear that are quite common as emergencies, which you'd want to treat, are those artematomas where there's a blood pocket in the ear. The faster you get that out, the better, especially if you're doing the sort of the drainage techniques when they're really small. You can actually get away from surgery with those lumps if you bring them in soon enough.
So be as proactive as...
Yeah, and then if it's a bee sting, you want to prevent anaphylactic reactions. So you do want to treat those sooner than later. But also, infections, you want to get on top of them before they get worse.
And these things...
And they get worse quickly.
Yeah, they progress. Like you say, not only are they sore, but sometimes we find they're really itchy. And then the damage that they do as a result of either because they're painful, scratching or itchy, that they get bigger and they maybe cause, even the hot spot, I know that is not always associated with a lump, but we see how quickly those can kind of progress.
Yeah, 24 hours, suddenly you've got a small little hot spot and they spread really quickly, especially in those long-haired dogs where you can't actually, you think it's that size, but as soon as you take the hair off, you realize how extensive it's spread underneath.
Yeah.
Even in a day or two, it's actually amazing how quickly those can go wrong.
So from tiny lump to big,
to a massive thing, and it's painful and itchy. You really want to get on top of that quite fast.
I totally agree. So again, we're going to go there in terms of the lumps, but you receive the patient, and there are a lot of things that you do in a consult and during a clinical examination that owners may not even be aware that you're doing. Take me through some of the checks that you do if there is a lump and you're trying to determine what the origin of that lump is.
Yes, ideally the first thing you do is to actually ignore the lump completely and start off with just a general clinical exam. Is the dog otherwise looking bright and healthy? How's its coat? Does it have a temperature? Is it looking anemic or anything? Because especially as a vet, the one thing you can do is, and especially when you're a bit busy, you can do that. You hone in on the lump and you forget about the rest of the dog, whereas, they're coming in together. So ideally you should ignore the lump for just a little while you just make sure everything else is right. Because if there's a lump and something else, then, you've got a different picture than just the lump. So that would be the first thing you do. And then what you do next is to give the lump a little bit of a feel. And that's often a problem I find. People, they've got a lump and then they send you a WhatsApp picture. And so that's so not useful at all, because one of the main ways to differentiate what a lump is how it feels. There's so much information, more so than what it looks like, as just looking at what a lump feels like.
So what are you assessing for in that feeling?
So you'd assess for size, where it is in the body. Is it in the skin? Is it underneath the skin? Or is it even underneath the subcutaneous layer, in the muscle or the bones? Or, so where it is, the size, and then is it a discrete lump, which is, it's something that's sort of small and well-defined. It's got nice round edges, or is it something that's, sort of more spread into the skin? And then is it fluid filled? Is it painful? And that can give you a lot of information as to what sort of lump you're looking at.
Absolutely.
But the next thing you got to do is stick a needle in it, get a sample.
Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little one strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. So let's go into that. So from what I'm understanding, we start with obviously a clinical examination, get the history and whatnot, which I know is part of it. And we fully examine the dog, including the temperature, and the temperature what might just tell you whether it's sort of inflammatory or how sick they are and whatnot. So lots of things you're gauging. And then you're checking the lump. Is that something that you can generally do when they're conscious? Is that something that you...
Generally, it does depend on where the lump is sometimes as well. If the lump's in the back of the throat, then you really got to sedate them to have a good look at that lump. You're not going to be able to do it all. Sometimes in the ears, or if the dog is just not some dogs just like, no, I'm not having that. And then you need to sedate them. But mostly you can do that in consult, especially if you've got the owner maybe giving a treat or something if they are a little bit
anxious,
not feeling like getting poked and prodded.
So now we're going to the point of saying, we want to assess what is the lump made of, what is inside. And sometimes you can get the impression because you can feel that fluid or the heat, or, you can feel, generally
you can get
quite good at knowing whether that's an
idea.
Abscess. And I mean, I've walked in before and, you're treating an abscess, and some people are completely grossed out by that. So we often check with owners.
Yeah, I love abscess.
I know
some people hate them, but they're great.
I remember the one case that everyone was like looking. So abscesses obviously are managed very differently to our other lumps, and we're going to clarify that. But you talk about sampling that mass in order to determine. So take us through how you do it. Is it something you can generally do conscious?
Yeah, so there's a couple of ways you can sample the lump, but the easiest and what you do sort of most commonly is an FNA, which stands for fine needle aspirate. where you take a needle slightly bigger than the normal one you use for injections, because you want to get a decent sample, and you stick it into the lump, apply a bit of suction so that you get cells into the needle. You spread that out on a plate, stain it with some Diff-Quick stain, or other stains. Some practices do other stains. We'll say Diff-Quick because that's what we use. And then you take a look at what the cells look like under the microscope. And that can give you a very good idea of how nasty the lump is or not. And a lot of the cells you can tell, even when you pull it out, you can get an idea, like an abscess, for instance. If you stick a needle in and pull out a horrible amount of pus, you almost don't even need to do an FNA at that point, because, you've got this stinky mess coming out. It's like, okay, that's an abscess. But yeah, otherwise you look at the cells and look for signs of malignancy. You'd be looking for nuclei that have 2 nucleoli in them, cells that are not well differentiated, where you get smaller cells and bigger cells, and cells with 2 nucleus and cells with 1, and just all looking a bit haphazard rather than nicely organized cells. So the haphazard ones would be more tumor, fast-growing, crazy cells that are doing their own thing, whereas the nicely organized cells would be more normal, benign lumps that aren't going to go crazy and do strange things.
Yeah. Okay, so now's a good time to go there, I think. So when we talk benign, what does that term mean?
So benign means that it's not going to spread to other organs. And so you can get a benign, locally invasive one that may, especially if it's something that's quite fast growing, you can get it spreading locally, but it's not going to go into your organs. It's not going to go into your chest or your spleen, liver, and things. It's going to stay where it is. It's going to stay growing. Probably quite slow growing as well. They tend to not be too reactive. So they're benign. You can leave them. And then malignant means it's going to spread to somewhere else. It'll go probably first to the local lymph nodes, and then, depending on what the tumor is, to different sites in the body.
Okay. So that obviously is now going to determine what you see as to how proactive and the kind of advice you're giving to the owners about the next step. So let's talk about the benign ones, because obviously now you've explained to us that they don't generally spread. They're often, when you were describing them, you were describing how some are attached and some are lumpy and multiple lumps. How would you describe a benign mass generally? If you're kind of going, I'm going to FNA this, but it's probably something like a lipoma, it's a fatty lump or whatever. I can tell by its texture. What determines initially?
So some of the common ones are like those little I call them old man warts. The fancy name for them is a hamartoma, but they just, especially little Yorkies and things, as they get to sort of those geriatric stages, they get these little small, well-defined lumps. They might be a bit friable or something, but generally those are benign, and you're going to leave them alone. You're not going to remove them unless they're irritating the dog. If they've got one that they keep scratching open, it might be benign, but it's probably best for the dog if you take it off, because it's going to bleed, it's going to get infected. But unless they're irritating the dog in some way, maybe another example would be of a benign lump, but like a meibomian gland adenoma, which is on the edge of the eyelid. Like that lump isn't going to do very much necessarily in terms of spreading anywhere or being dangerous, but it's on the eye. So it's irritating the eye, it's irritating the cornea, it's got to go.
Yeah.
So, so those benign lumps, also lipomas are common ones that are benign. And you can get a feel for them. You can grab the lump and they've got a soft, squishy texture. You can kind of tell that it's a lipoma. And especially if a dog's got lots of them. You can be like, you can be pretty confident that this is a lipoma. But you can't be sure until you've stuck a needle in, because one thing that feels a lot like a lipoma is a mast cell tumor. You don't want to leave that one. So
let's talk about, because I think a lot of people have gone through the experience of having, if they've had a dog with a lump, of having their FNA. There are obviously complications, but it's not always straightforward in terms of the sample site and getting a sample that's sort of diagnostic in either quality or
because you're only getting a tiny needle full of cells. So although we can get a lot of information from that, and what's quite nice nowadays is we've got these fancy, I forget what it's called. What's it called again?
Imagist,
yes.
AI.
Yeah. So there is an AI portion to the Imagist. What I'm talking about is when you've done your smear, and a lot of smears we're quite confident to do ourselves. Like if I see a lipoma, they're poorly cellular, you can just be, that's a lipoma. But sometimes is this nasty? Is it not? What we can do is actually nowadays we can take that smear that we've done in-house while in consult and send it off to a specialist overseas who'll look at it and give their opinion on it. And they're, as much as we know quite a lot about getting FNAs, this is their day-to-day 9 to 5 is looking at cells under a microscope. So they're just much better at it than us. They've got specialist qualifications to do that. So that's quite nice nowadays, that we can actually send those slides off.
Definitely.
Yeah.
I feel a lot more reassured with that kind of questionable one. Like, is this is it something to worry about or not? It's pretty much immediate, is it?
Yeah, it takes often same day. Sometimes it'll be the next day. But yeah, it's pretty immediate. We put it on a little scanner with a microscope on. It scans it in quite high quality, and they'll send that image off of your little slide in our lab. It'll send that off overseas to get looked at.
It's incredible.
So that's quite nice. And there is a bit of expense, but it's not that much. And then sometimes you can get a lot more information about whether you should take it off or leave it.
And in terms of other possibilities, I mean, how often is it that you put a needle in and the dog resists it, or I'm going to use another example, it bleeds profusely? I mean, what are the kind of complication rates with these sort of procedures?
Yeah, I'd say pretty low. You don't often see them. Generally, if there are complications, it would make me concerned that it's a nasty lump, because a nasty lump's going to have a really excessive blood supply. And then you'd be a lot more concerned, like, hey, this actually needs to come off.
Yeah.
If you're getting complications. But generally, I actually don't think I've ever had a comeback from an FNA. They might bleed a bit. But yeah, I don't think I've ever had a FNA complication where they get infected.
No, I haven't either, but I'm just doing this for the benefit of reassuring our listeners not to delay the FNA.
Yeah, it's a really simple thing to do. The dogs mostly don't even feel it. They might give a little squeak and see, what are you doing? Because you are sticking them with the needle. It's not completely painless, but you can distract them from it really easily. Generally, they're so excited to be at the vet that they're not that worried about it. And you can sedate them if you need to, but it's very rare that you need to do that.
I agree.
Yeah.
Okay, so let's talk about the more serious ones before maybe we come back to the in-betweens. There are lumps and there are masses, there are lesions that we look at and we go, ooh, I need to be quite proactive here. I'm not going to be saying, don't worry, just watch it. We'll see you at your next, vaccination appointment. What are the red flags for those ones?
So lumps growing really fast, lumps that feel soft, but not like a lipoma. It's kind of different soft. I don't know. I can't explain it unless you've felt a few. But yeah, lumps that are growing really fast. And then if you have a look at the FNA, if you see, especially with bad differentiation, those cells being all a bit different, if you see mast cells, then you want to be really proactive about that, because those do have a tendency to spread. And also they spread locally as well. So you've got to get really good margins. They send out little tendrils of cells into them. So, if you leave it and you've got to take really big margins this week, if you leave it till next week, the lump is bigger, your margins are 4 times the size that you've got to take. And then it becomes so much more difficult to remove. Removing a tiny little lump with, and when you're taking 3 centimeter margins is one thing, taking a 10 centimeter lump, and then you've got, suddenly you're ending with a reconstructive surgery to remove it. Yeah. Also, lumps, they might not look big, but lumps on the end of the feet, so on the paws or on the sort of lower end of the feet where there's just not a lot of skin. If you grab a dog at the top here, you can like lift their skin. You can almost feel you can chop all of that away and still be fine because it's, you got a whole handful to deal with. But down at the bottom, you can't take it off because you can't get skin to close it. So definitely lumps on sort of below the knee on the legs. You want to get those off while they're small. Because
and the tail.
If you leave it,
I suppose.
Then, the tail as well. There's no skin to close it with. So if you leave it, you end up either with a reconstructive job or if it's something nasty with an amputation.
Sure.
So if you can remove it while it's small, it's a small job, it's easy to stitch, it's going to heal. If you leave it when it's big, you can't close it. There's no skin there. You've got an open wound. It's just not great.
No. So it can be quite a big thing to go through. So being proactive sort of mitigates some of that by...
Yeah, they're just so much easier to deal with when they're small. The anesthetic is less. You can whip it out. Sometimes if they're really tiny, you can just use a little biopsy punch or something. If you're lucky and they're that small.
And obviously, I mean, it's something we encourage owners to be aware of, but it can be really difficult in a dog that's got a long coat. These are the kind of things that people may not notice when they're small. So there's no blame game here when owners come in, particularly, when their dogs potentially are outside and, they maybe don't have them inside and they're not interacting with them as some owners do, or they have long coats and you're not seeing those lumps until they get to a particular size and you're like, whoa, that's quite obvious. Or under the abdomen. Some dogs don't particularly like to have their tummy scratched, or even cats. We're talking dogs here, but this is applicable to our cats as well.
Yes, you're not always going to spot those lumps. If you've got a big lump and you haven't spotted it, you just deal with it as you can.
Yeah. So, okay, let's talk the middle ground. We have a lump. We can see that it might be suspicious. Maybe it's irritating, maybe it's ulcerated. It may not be something that from a cellular perspective that we're going, whoa, this is a red flag, it's not mast cell, it's not, something that's scary from a histopathological standpoint. It's a lot. But it may be causing either the owner distress or the dog distress, cat distress, and we're saying, we think you should take it off. Let's talk about the procedure of doing that, because that's not something that we can do conscious. That's something that...
No, you can't, because even if you could get local into the area, the dog's not going to sit still for 20 minutes while, and make small talk about the weather. Like if you've had moles removed, that's what you do. You sit there quietly and the doctor works. But a dog, even if they're the very best dog, you can't trust them to not jump off the table with an open wound when they're awake. It's just not safe. You've got to put them under an anesthetic, even if they're the most well-behaved little dog. It's just not worth the risk of trying to do surgery on an awake dog. So you got to put them under.
So what's the next step? Because obviously, I think one of the things I've spoken about before when I was talking to Peter Hanekom was when we were talking about the cardiac scan and the horror when you do not inform owners of the clip that you need to do in order to do a heart scan. How often do you find that owners are slightly horrified by the area that needs to be clipped and prepped in order to have these mass removed? They're like, it was so small and you've clipped this big area. So explain to us, just for clarity, what we're doing there, the fact that we have to shave them and what the purpose of that is.
Yeah, you got to prep them for surgery because you want to have a sterile field. You don't want to end up with an infection there. And sometimes maybe you're going to go in there and find out, it looked like this a little bit, but on feeling, on opening, I'm a bit suspicious. I want to cut a bit more. What you don't want then is to have your wound and then realize you haven't clipped enough. So you do have to clip a pretty wide area. Like he's not as bad as Peter. There's heart scans, they do look really funny, shame, when they come out with their two squares on either side of their chest.
we make a real point now of, again, that spending time explaining to owners. That's what's really great about our nurses and our reception team is that, the time taken for admission to explain so that it doesn't come as a big shock. They're going to wear a cone. So let's talk about, so before we get to the cone part, so in terms of the procedure, they're anesthetized, the area is clipped, shaved, sterile prep. You're taking them into theatre, or you're doing it with gloves and a sterile field. What are you doing in terms of margins when it is not something necessarily malignant? Let's say it's a well-capsulated or
generally we'll try to take pretty, we'll take enough margins, especially if we've got the room to do it. If we're going to go on the back, we're not necessarily going to cut around the tiniest thing because we don't have to. It's going to heal really well. Rather take decent margins. They don't have to be massive, not like if you're taking out a mast cell or something where you really got to be sure that you're taking out big margins, but you take enough that you're going to be able to close it nicely. But then what you do is you send it off for histopathology to make sure that you've got all the margins. And then also, instead of just getting a little needle full of cells, they take that lump and slice it, set it in wax, and then they look at how the lump is organized on the whole, not just a mush of needle cells, which can give you a lot of information. And they also look at, they're not really interested in the middle of the lump when you do histopathology. They're really interested on the edges, how that lump is spreading into the normal tissue. Like, is it spreading into the tissue a lot? Is it spreading not at all, which is what you're hoping for, that you've taken good margins and that the edge of your tissues are, I'm going to say tumor-free, but it's not necessarily a tumor exactly, but free of
those cells.
Yeah, free of the cells that you've taken out. So that's a really good idea, is to send for histopathology afterwards.
And this is something a lot of people are quite reluctant to do. What is the reason?
I think it's the cost. It's expensive, but it's, I think, for your, especially if it's for something that's a little bit you're unsure of, it's a really good idea to get it sent off, because then you can get a good idea of exactly what lump you're dealing with, because each lump, each type of tumor is going to be managed differently. You're not going to manage a hemangiosarcoma the same way as you handle a mast cell or a lymphoma or something like that. The treatments are very different. So to get a good idea is, like, do you need further treatment? Because if your margins are not clean, so say you've got a nasty lump, actually, you think, oh, it's a benign thing. Send it off to the pathologist, and they say, well, it's not so benign, and also your margins are not clean. Then you've got to think about maybe more follow-ups for one, but also making sure that you're doing chest x-rays or ultrasound scans to see, is this mass anywhere else in the body? Because that's going to change your treatment plan. Whereas if you get a histopathology report that says something benign, the margins are clean, that's pretty much job done. You can maybe do a follow-up to make sure that it's not returning anyway, but
or anywhere else sometimes. Yeah. Hey? So let's take, as you've opened that can of worms, let's talk about a case example, like a mast cell tumor that you're now concerned, maybe, it's been there for a while. You spoke about the next steps, and that included taking an x-ray. Let's talk about some of the things that you're looking for to determine, both maybe from, you're going to send that mass away to check the margins, which you've explained really nicely for us, but what are the other things that you're doing in order to just check general health and status of this patient?
Yeah, well, in-house we can do you can do a blood panel, which generally you're looking for raised calcium, but also other abnormalities like, is the liver healthy? Then you might be a bit more concerned, like, had spread to the liver if the liver enzymes are raised. So you can do blood work. Although people often think that when you're doing, they say, I'm going to do bloods, they somehow think that the bloods are going to magically pick up any sort of cancer. And that's really not how it works. We look at indicators of organ function that can tell us where to look. Because I often come in with clients that have said, oh, he went for bloods and they said that, and they indicated that he's cancer-free, which is not something bloods can do at all. Like any bloods, really. You can test for a very, very, very specific type of cancer with very, very fancy, expensive tests, but that's not something we do when we talk about doing bloods. So, we can do bloods, but what we're looking for is indicators of disease. So high calcium would often pop up with a metastatic disease. Then the other things we look at would be x-rays, ultrasounds, to look for lesions there that may indicate, lumps and bumps in the chest, in the liver, in the spleen, or in the heart, in the terms of a hemangiosarcoma if you're finding lumps in there. Although that's a different kind of lump because they won't come in with a skin lump. They've come in with a spleen lump. We find it a little bit differently than those typical lump consults.
And those kind of tests, obviously, there are costs associated with them. I mean, doing a thorough workup, particularly when you find something that you're suspicious of, in order to be thorough and in order to cover your ground. I mean, even like you said, looking for elevated calcium or anemia or whatever it may be, inflammatory markers even within our bloods. It's giving you information that may determine either your advice in terms of course of treatment, prognosis. And those things are really valuable to have at hand, including things like you said the chest x-rays. I mean, starting off with a chest x-ray, if you see metastasis there, changes the conversation.
If you've got a lump on the leg and also a lump in the chest, don't go doing. Well, I mean, you can, but it's not a good idea to go doing reconstructive surgery to take the lump off the leg. Because it's already spread. Yeah. So then the way you're dealing with it is completely different. Firstly, you're not going to go for unnecessary surgery. You might do a little biopsy, which is often a good idea anyway if you've got a big lump and it's nasty and you're not sure about how you're going to get margins. So first take a small sample and send that off to the histopathologist and then work your plan from there. But definitely doing further imaging and things you manage your case completely differently.
Absolutely. And I mean, there are, not only from the pet perspective, there are often limitations in terms of what people can emotionally manage, what they can financially manage, and sometimes a combination of the two.
Yeah, it's tricky sometimes because they're not free.
No.
That's blood tests. You got to put the slides in the machine. You can't just. They're not free. You can't do them for free. So, it does become a little bit of a conversation. Like, how much are we going to spend to do this? And sometimes you can be like, oh, this looks like a little hematoma. We don't necessarily need to, because we've got a high suspicion that it's benign. We're only removing it because it's irritating the dog. We're not really that concerned about it. It's the FNA came back as looking like nice little organized cells. So, in those cases, if it's always nice to do histopathology. But in those cases, you can work within the budget and say, we're not going to go ultrasound your liver and do a chest x-ray if we're taking off a hematoma. So it goes a little case by case. But if you can do it, it is better. Sometimes even just for peace of mind. Like you can be like, we don't have to do follow-ups. We don't have to worry nearly as much, and that's quite something I think for people, because if you've got a lump and you're sitting every day, you look at the dog's lump or you look at where it was taken off, you're like, has it spread? You don't know. Some people
they need that clarity.
Spend a lot to get peace of mind.
And I think often the conversation we say is determined by owner preference or want or need, and then also age of the pet. We obviously see more of these lumps and bumps in the older pets. Is that right?
Yeah, and if they're 16 and they've got comorbidities, you're not necessarily going to manage them the same way as a 2-year-old that's healthy, that's got a lump. Sometimes you might say, well, he's got a nasty lump, and we're not going to do anything about it. That is, it's not always in our nature to do that. We want to give them all the options, but it's also important for clients, that sometimes no treatment is an option. It's sometimes difficult because it's really a case by case thing.
But you can work with your vet. I mean, we certainly
you should work with your vet in what your expectations are, what is possible, what's not possible.
What do you want? What do you want from it? And sometimes it takes a bit of time, and we've had owners that have come in for a consult. It's a huge amount to take on, and I don't know how often you found it, but you're explaining things and you're going through it, and they're hearing nothing. They're hearing nothing.
It's just so much information. They came in with a little lump, and now
and next you're talking about procedures and
words they don't understand. You're talking, metastasis and big words like hemangiosarcoma or osteosarcoma. it's too much to take on in that half-hour consult. That you're telling them this, that, the next thing, and it often comes with, well, we can do this, we can do that, we can refer, and CTs and MRIs, and which is all possible. If you come in as a human with a nasty lump, they're definitely going to go for all the things. You're going to go for nuclear medicine. And with veterinary science being where it is, all of those things, if you want to go for a PET scan with your dog, probably someone somewhere can make it happen in conjunction with a human hospital. So there's all of these things that are possible, but not necessarily the treatment option that you're going to go with. So it's a lot to take on, and it's a lot to decide. Like, are you going to treat this dog like a little human? But then you're going to pay, human related, because it's the same things. If you're going to go for an MRI is going to cost what an MRI costs. And it's, in private medicine, if you have to pay for your own MRI or your dog's own MRI, they're just not cheap. They're just completely out of the reach of your average person to go do MRIs on their little poochie, especially if they're older. You're going to do all this stuff, and then the life expectancy is only another year anyway.
So these are big conversations that you're having in your consult room. How often do you find owners come back and say, I need you to explain it again?
A lot. Yeah, it happens a lot.
Yeah. And I mean, the great thing is that obviously, we've got a good support system here. And sometimes, if we find we're using terms that are too technical or whatever, the ability to be able to ask a nurse or one of who may.
Yeah, so sometimes you just rattle off. You're like, you speak like you're talking to one of your colleagues. You're like, oh, he's got an osteosarcoma and we're going to do these imagings and blood work and we want to check out his urea creatinine levels because he's older or he's on. And it's, all of these words that the owners are hearing for the first time in their lives. I don't know what any of it means. Shame. I do feel quite sorry for them sometimes that we just start talking vet.
We're becoming more and more aware of the importance of that kind of communication. I mean, and it is okay whether you're clients of our practice or whether you're based somewhere else of going back and saying, I need you to explain it again, or can you simplify it, or can you clarify this, or what are you really trying to say? Because I think we also are human in the sense that delivering bad news is tough.
Yeah.
And, you may get a vet with a particular bedside manner who will just say it how it is. But most of us find it quite difficult to deliver bad news. And so there might be a little bit of sort of skirting around and like, we could try this. And actually, in the interest of the patient, if the owner doesn't want to, we can actually say it's actually okay if you don't want to do anything.
Yeah. Yeah, and it's almost a bit hard to say that as well, because you don't want to imply that they don't want to do anything. Sometimes it's fairly obvious, and we can, in the best interest of the patient, we can guide them which way to go. You can be like, this really, we shouldn't be doing anything here, and you can quite confidently say that. But sometimes it's not so cut and dry. Well, this could be this, could be this. We don't actually know. We can spend a ton of money and get a really poor outcome. We can spend a ton of money and get a really good outcome, and the decision's up to the clients. And it's a lot for them to take on, but ultimately, with these big decisions, it is their decision. They're their pet's advocate. So,
yeah. And like you say, you can spend a huge amount of money and things can go to plan. And then there are obviously complications associated with surgical procedures. You gave an example of, if you're removing a mass from an extremity or a limb or a tail or a face or somewhere where there's, difficult in terms of closure of the skin, you can get wound breakdown. There is the possibility of post-op infection. They go home, they go into an environment that is not controlled, we try and sometimes send them with a dressing or, with a cone. And this is where I'm going with that. So there are things that we do to try and mitigate some of that risk. But it is not something that we can definitely say this is going to be the course of the recovery. And so it's explaining to owners and trying to manage expectations. And even in terms of prognosis, I mean, we wish we all had that crystal ball where we could say this is what's going to happen and it's going to
because they say, what are the chances? And often you just don't know. Yeah. Some dogs recover, some dogs don't. Are you going to be one of the lucky ones or one of the unlucky ones? And sometimes you can give a pretty good indication.
Yeah.
If you've got a osteosarcoma or something, that's the chances are pretty good that it has spread, especially if it's large. But you don't know, and then you've got to decide, are you going to amputate this dog's leg in the chance that it hasn't spread, and what is that chance? That I probably can look up the statistics exactly, but some dogs are going to survive, and you've caught the whole thing, and it's all been worthwhile. Another dog, you're going to amputate the leg, and then a couple of months later, it's back, it's in the chest. So that's really hard sometimes to make that decision, because you just don't know. Are you going to be one of the lucky ones or not? Because
it can be heartbreaking. And I think that's why it's so important to have a good relationship with your vet and be able to monitor things and progress together, to be able to say, this is what I'm seeing, is this a sign? And when we talk about the do nothings, I mean, it's not that we're suggesting we do nothing. There is palliative type care, which means
you'll give them pain relief.
Provide pain relief and monitor. And we have had things, you talk about the osteosarcs, where they may either they present, but also they might suddenly deteriorate and end up with a fracture or something that may mean a very sudden decision is made, and others that
that's a classic case of a kind of do nothing, because a lot of the ones where you say you're going to do nothing, if the treatment is simple, you should probably go ahead with it. Remove the lump, see what you can get away with. If it's going to heal nicely, 10 days later, it's going to be like nothing happened. Osteosarcoma would be a different story, because to get rid of that, you've got to amputate a limb. So, the way you manage the two different cases, the one is more appropriate to do nothing, the osteosarcoma, especially in larger breed dogs that are but arthritic anyway. They're really not going to tolerate that. Whereas, you don't necessarily want to do nothing in a different case where it's a skin lump or a mammary lump, or even something that's going to be a big surgery, but once they're healed, they're going to be hundreds. So
let's take a quick moment before we run out of time to talk about what happens afterwards, because obviously we do send them home with a cone of shame.
Cone shame.
Yeah. So what is the time frame, having removed these lumps, for healing, if it's been a relatively straightforward one?
If it's a relatively straightforward one, you want to keep the cone on until the stitches are out. Because what you don't want is to keep the cone on for 10 days, and then on day 11, when the stitches are about to come out in a few days' time, you're like, oh, it's fine, it's healing well, take the cone off. And then it opens up again. And then you're back to square one, or square minus one, because now you've got an open wound plus an infection.
Yeah.
So you really want to keep that cone on until it's healed, which will be generally 10 to 14 days for your average stitches out. But longer if there's, you've got a complicated case, you want to, high tension areas, you might want to keep those stitches in that cone on for a little bit longer.
And I mean, in terms of the medication, so sometimes obviously if there's no sign of infection, we don't use antibiotics. We don't just freely necessarily use them, but we often send them home with anti-inflammatories.
Yeah.
What is your advice? Because I have often found that owners will use it for the first day or so, and then they discontinue using them because they're like, they're fearful of them. There's a, they don't want to.
It's a good idea to keep taking them, even if you don't notice signs of, the dog's not going to cry out in pain, because, like I said before, that's not how they got to be in severe acute pain to vocalize. So, they might be showing pain and not really indicating it much, or it may be very low grade pain. And if it is painful, they're going to investigate. They're going to lick it. So you're preventing complications by giving the anti-inflammatories. Because if it's not sore and they can't feel it, they're not going to carrying at it. They're going to leave it alone.
Which is what you want.
Yes. Yeah. You don't want them sitting rubbing up against the sofa because they're a little bit sore, a little bit itchy, or you'd rather want to give them the anti-inflammatory, so that you're just minimizing your complication risks by properly following the full course of the treatment that was given.
Now, I know we don't do a huge amount of it in this practice, but I also, just because I know I'm going to get this kind of question, if we don't just cover and touch on it. There are times that we are seeing the very malignant ones, and owners want to be very proactive. and maybe there's removal of that mass like we've discussed, but then they want to either undergo radiation or chemotherapy. Explain, just to touch on it, just, what this is and when this may happen in terms of some cases.
So that would generally be, like you say, we don't do it a lot because there's people that are just better at it than us, and they've got the knowledge and the latest, greatest, up to date. So that would be generally would be referred to a more specialist center. But there are often options that you can do for tumors. And people, when they hear chemotherapy, they get very scared because humans don't tolerate chemotherapy very well. But what I found is that dogs actually do very, very, very well with chemotherapy. They might feel a bit nauseous on the day after or get some minor complications, but they actually people get terrified because you've seen either in person or, even in film and stuff. Chemo in humans is horrible.
Yeah, it's often very high doses, multiple things, trying to get people into remission. And that's not always...
they feel terrible. Your hair falls out, you get anemic. And the dogs and cats, they do get, they might feel a bit nauseous or they might get those anemias and things, but they definitely don't feel unwell, in my experience, to the same extent that humans do. So one thing I would say is to not get so much of a fright when your vet might suggest chemotherapy, because the dog might take it without any side effects at all, almost on occasion. Especially we do a lot of transmissible venereal tumors here with our valley dogs that we get in with that charity. And then they hardly notice at all. They're eating, they're happy, and they're getting a chemo injection every week, but then you wouldn't know it. They pick up weight. They start looking better with the chemo than worse. So I'd say don't necessarily be scared of the scary sounding treatments.
Or put off for not at least investigating what that will mean for your
because the dogs often do very well on them. They don't get the same sort of side effects.
Well, hopefully this has provided a bit of an insight. Obviously, we're welcoming any questions, any particular things that I'll probably refer to you or if I'm keen to answer them. But on closing remark, just in terms of if we have an owner who's listening and they've noticed a lump, what is the take-home message here?
So go get it checked out, because maybe you'll go in and your vet will tell you it's a nipple. Don't worry. And then you can rest very easily that it's a nipple or a hematoma or a lipoma, and you can just leave them alone and worry about them if they're bothering the dog. But the sooner you bring them in, if they do need to come off, the sooner you take them off, the better. They're smaller, the surgical time is less, the complications are less. And if you are going to be doing the whole 9 yards in terms of treatment, the whole 9 yards when you take off a lump that's this size, it's very different to a whole 9 yards when you're taking off a lump this, the size of a soccer ball. It's just so much easier to deal with. Rather get them seen to and get peace of mind that it's nothing and you can leave it alone, or whip it off early, get sent to Histopath, take those, make sure that we've taken those margins. We can maybe do some imaging depending on, what the lump is or what the findings are in Histopath. The sooner you get it checked out, the better.
That's great advice. Thank you. Thank you for taking time out of your day. It's been a great conversation. I certainly enjoyed it. So I know the listeners will too. So thank you, Dr. Lauren.
That's a pleasure.
Good luck with your night shift tonight.
Thanks. Yeah, it's just I'm heading there now. We go do handover.
That's really appreciated. Thanks again. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.